Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, question analysis sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer, a reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. All right, updates on where we are with current things. Our practice question course, again, is November 2nd from 10 a.m. to 11:30 a.m. Eastern Standard Time. We have 5 spaces available for this. So if you are looking to join us, make sure that you click the link in the description and grab your spot. During this time, I will be going over the exam breakdown and blueprint for the ANCC as well as AAMP so that you walk away knowing what to expect and having an idea of percentages in those areas on the exam. We will also work on live practice questions for each system. I'll discuss how to answer each question type. I'll provide you with test taking tips, and you will also get the practice questions that we have covered as well as tips. Okay, and that is $89. And then the antibiotic worksheets and diabetes worksheets are also linked in the description. Antibiotic worksheets are $12.99. Diabetes worksheets are $14.99. All right, now this week's series that we're covering will be asthma. So we're going to cover the GINA asthma guidelines, as I find that y'all have had difficulty with this and knowing which guidelines are on boards, which ones to adequately prepare for, and how to approach these questions. So y'all know I like to start with like knowledge-based things and then gradually go into the application of it. So we'll work through that as we navigate through everything asthma this week. All right, so question number 1. The nurse practitioner and NP student are discussing asthma triggers. Which of the following is not considered a common trigger for asthma exacerbations as outlined in the GINA guidelines? Is it A, allergens, B, respiratory infections, C, exercise, or D, high protein diet? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what's being asked of you. So here the stem of the question states, which of the following is not considered a common trigger for asthma exacerbations as outlined in the GINA guidelines? All right, so not we're looking for what is incorrect, right? So asthma triggers, is it A, allergens, B, respiratory infections, C, exercise, or D, high protein diet? Now, when you think about triggers of asthma, the one that's incorrect is D, a high protein diet. Allergens can trigger an asthma attack. Respiratory infections, of course, can trigger the asthma attack. And exercise, it's called exercise induced attacks. So that can also trigger it. So make sure you are, it seems simple, but make sure you're keeping that entry knowledge on the forefront so you don't miss things like that. Because also they can tie that into a scenario and it'll be just that simple of knowledge that you need to know, and you find it more difficult because you're not refreshing on those areas. All right, question number 2. A patient returns to the office and their asthma is not well controlled on their current therapy. According to GINA guidelines, what is the next best step by the nurse practitioner? Is it A, increase the dose of the current medication, B, add another medication, C, review adherence to current medication, or D, nothing is warranted at this time? Take a moment and tell me what you got. All right, so here, stem of the question states, according to GINA guidelines, what is the next best step by the nurse practitioner? All right, so what do we have going on? This patient comes back to the office, their asthma is not well controlled on the current therapy that they are on. So what would you do next? The best answer is C. You want to make sure that they're actually being compliant and adhering to the current regimen before looking to do or change anything additional. That is why we move to the different treatment options, because a lot of times asthma patients are on multiple treatments, multiple inhaler options, and they're not as compliant. So always make sure you review their adherence to the current medications before adjusting anything. All right, lastly, question number 3. According to GINA guidelines for the management of asthma, what is considered the preferred reliever? Is it A, Asaba, B, Alaba, C, low dose ICS plus Alaba, or D, a low dose Saba plus Alaba? Take a moment and tell me what you got. All right, and stem of the question here is what is considered the preferred reliever? So when we're talking about GINA guidelines for the management of asthma, we know that the preferred reliever is a low dose ICS plus a LABA. So just like I was talking about in the last question, we have found it more effective and more compliance with combo meds. So these inhalers include an inhaled corticosteroid plus a LABA. And we have found more efficacy, one, because people are more compliant to it, but also the dual component of therapy versus saying, hey, if this happens, take this. If this happens, take this once a day. So this is why this is the preferred reliever. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you do need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number one, at gmail.com. Now, the things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to review independently, my self-paced review course is also linked in the bio of this channel. If you're looking for additional practice questions to complete, my QBank options are linked in the bio of this channel. And as always, if you're looking to book any one-on-one sessions with me, I always say reach out by calling, texting, or email so we can gauge which one is best for your scenario, I should say, for your learning needs, okay? All right, you guys, as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.